Hi everyone, this is another brief video on the stages of burns to help you with as you build critical thinking and as you prepare for your exam one. So there are 4 stages of burn that we'll briefly cover here. First, we have the first degree burns. First degree burns, which will be your superficial burns. So for critical concepts here, I want you to know that during this stage, first degree burn, the patient is not losing any kind of fluid. Okay, so there's no fluid loss. The burn is just superficial, and at this point, they may experience a little bit of pain, but it's not very mild pain. Okay. Second degree burn, this is when blisters begin to form. Okay, so we have blisters at this point. This will probably be the most painful. And now the patient is losing fluids and electrolytes. And again, if you watch the previous videos, there are 4 major electrolytes we're concerned about in relation to burns will be potassium, magnesium, sodium, and calcium. Okay, especially sodium and potassium. So stage 2, blisters are beginning to form. There's a formation of blisters. So if you don't see a blister, it's not stage 2 yet. Okay, you have to see that blister. Very painful. Patient is losing fluids and electrolytes. Okay. Stage 3, this is where we see so stage 1 was superficial thickness burn. Stage 2 is partial thickness. Yes, partial thickness burn for stage 2. Okay, now stage 3 is full thickness burn. Okay, for stage 3 is less painful. Okay, it's not as painful as stage 2, and there's a whitish thing that is forming around the burn area. We expect to see that. Patients are still losing fluids at this point, so they are still losing fluids and electrolyte for stage 3. Now stage 4, which is deep full thickness. So we have stage 1, which was the superficial burns. Stage 2 was partial thickness. Stage 3 was full thickness, and then stage 4 is deep full thickness burn. Okay, so stage 4 now, stage 4 degree burns, no pain at all. Okay, no pain at all. So there's no pain involved here, and again it's deep thickness burns. So I just wanted to just give this, so when you're answering your questions, you're looking at it will help you with your critical thinking, just knowing that for stage 1 again. Okay, I'm trying to keep this video 5 minutes. For stage 1 again, this is the superficial burn. Okay, no fluid loss and just mild pain or no pain, but mild pain. Stage 2, very painful. We have blisters and we have fluids and electrolyte loss. Stage 3 is less painful. They have a little bit of pain, but less painful. And stage 4, which no pain. So stage 4, this is when it's going into the muscles and the bones and the nerves. All of that have been affected, so no pain whatsoever. Therefore, if a patient has sustained a major burn, okay, a major burn for say over 48 hours or over 24 hours, we expect what? Fluid loss and swelling. Okay, so major burn, fluid loss and swelling over 24 hours. Okay, I'll kind of round this up, and then again, just know that the electrolytes that you're looking at is sodium, potassium, magnesium, and calcium. And the initial state of a burn, will see a patient with hyperkalemia. So the potassium will shoot up first. At some point it might drop, but the initial state it will be high. Okay, so these are your 4 stages of burn and how fluid and electrolytes are affected in these 4 stages. And okay, I'll continue building up, so this will help you as you answer your questions, critically think. The purpose of these videos is to help you to critically think. This is just to enhance the chapter that you're reading and to supplement the readings that you already have in your course. Again, this is Dr. Nayadong. I'll thank you. I'll see you later.